this session, we are going to learn about the most important topic in renal physiology, GFR, which is nothing but glomerular filtration rate. Now let's learn few numerical values related to the kidneys. Renal blood flow, 1.2 liter per minute. See, when we talk about renal blood flow, so this is the glomerulus and this is your tubule. Blood flows into the glomerulus. Blood is made up of two components. What are they? Yes, plasma and the cells. So in your glomerulus, the cells are not filtered because of the bigger size. Cells are actually not filtered and they are moved out like this. Then what is filtered? Plasma is what is actually filtered. See, that is why we leave renal blood flow and we always take into consideration renal plasma flow, because it is the plasma only which is flowing into the glomerulus and getting filtered. So renal blood flow in both the kidneys is totally 1.2 liter per minute. But what is renal plasma flow? Only 650 ml per minute. And out of this 650 ml per minute which flows into the glomerulus, how much is actually filtered? Yes, only 125 ml per minute, which is called as GFR. So the rate at which the glomerulus filters is 125 ml per minute. And can I take a fraction of this? So look at me. Out of the 650 ml flowing into the glomerulus, only 125 is filtered. So 125 by 650 is a fraction. What is that fraction called? Filtration fraction, or otherwise GFR by renal plasma flow. So it means that out of the 650, 125 is filtered. Or what fraction is 125 out of 650? So 125 divided by 650. This will give you your filtration fraction. How much is the filtration fraction? 0.2 or 20%. So there can be calculation based questions from this. Now let's move on to GFR. So how can you define GFR? So GFR is the volume of filtered at all the glomeruli in both the kidneys per minute. So we are not talking about one glomerulus, we are not talking about one kidney. So it is about the volume of fluid filtered in all the glomeruli of both the kidneys per minute. So what is the normal value? 125 ml per minute. And if I convert this value into per hour or into per day, you can get 180 liters per day. So just we'll do a small calculation. Look at this, the glomerulus and the tubule. So what am I saying? In one day, 180 liter is filtered by your glomerulus. So what comes here is 180 liter per day. What comes out as urine is, what is your normal urine output? Yes, only 1 to 1.5 liters per day. So around 1 liter per day. So can you think of this? 180 liter enters into the filtrate, but only 1 liter comes out as urine. What has happened to the remaining 179 liters? Effectively reabsorbed. 179 liter per day has been effectively reabsorbed by the tubules. See the enormous function the kidney does. In one day, it is filtering 180 liters and it is reabsorbing 179 liters. So such huge importance is the functions of these tubules, filtration and reabsorption. Glomerular filtrate. What is a glomerular filtrate? See, when you make tea, when you pour tea into the tea filter, whatever is there in the filter is your tea dust. And what comes out is the filtrate. So what is the difference between the tea that you pour and the filtrate? Only thing is that you are filtering the dust particles. So the dust particles are like your cells and proteins. So when the glomerulus is filtering, this is the plasma, this is the filtrate. So tea is filtered and what stays inside the filter itself? Your tea dust, which is nothing but your cells and proteins. So the filtrate is nothing but ultrafiltrate of the plasma, same as that of plasma, but the only difference is that the filtrate will not have cells and proteins in it. So why this filtrate is not having cells and proteins? Reason is cells are larger in size. The filter has pores in it. It will not allow particles more than 8 nanometer to flow into the filtrate. That's why cells are not filtered. Why proteins are not filtered? Proteins are negatively charged particles. You know that. Glomerular basement membrane, it is made up of heparan sulfate. What is the charge of heparan sulfate? That is also negatively charged. So this negatively charged heparan sulfate will repel the negatively charged proteins. That is why proteins are not filtered, because of heparan sulfate, which is also negatively charged. So now you understand that plasma and filtrate are same. Only difference is that the filtrate will not have cells and proteins in it. So what does this GFR depend on? GFR depends on net filtration pressure, which in turn depends on Starling's forces. So this is very important topic. Please listen carefully. What are these Starling's forces discovered by Frank Starling? So there are two forces acting on the glomerular side, two forces acting on the tubular side. So what are the two forces? One is called hydrostatic pressure and the other is called oncotic pressure. So let's learn in detail about these pressures and we'll come back to the factors. So look at this diagram. Hydrostatic pressure. So how can you easily understand this hydrostatic pressure? So all of you, you would have played this in your childhood days and even now when we pour water to our garden plants and all, what do? So when we use a hose pipe to pour water, so when water rushes out of the hose pipe, if you close half the nostril of the tube, imagine the force with which water comes out. So that is called hydrostatic pressure. See, hydro means something related to water. So hydrostatic pressure is the pressure contributed by the water component or the liquid component, and it is always a pushing force. See, when you close half the nostril of the pipe or the tap, water comes out with huge pressure. So this is called as hydrostatic pressure. So wherever you see hydrostatic pressure, you can just imagine it like a pushing force. It will push the filtration to the other side. And this is denoted by letter P. We usually use the letter P to denote hydrostatic pressure. What about oncotic pressure? Oncotic pressure is contributed by what? Think. Yes, it is contributed by oncotic plasma proteins. So what are the plasma proteins? So plasma proteins are albumin, globulin and fibrinogen. And these plasma proteins, you can imagine them like a sponge. So what will happen if you put a sponge in water? It will keep absorbing water. So that is the attitude of that sponge. It will keep pulling water. Similarly, if you have plasma proteins in any component, any compartment, it will keep pulling the filtration to its side. So always oncotic pressures will act as pulling forces, and this is denoted by letter pi. So hope you understand what are these hydrostatic and oncotic pressures. Hydrostatic pressures are pushing forces. They will push the filtration to the other side. And oncotic pressures are pulling forces. They will pull the filtration to its side. So with this knowledge, look at this. You have hydrostatic pressure and oncotic pressure acting on the glomerulus. So that is called glomerular hydrostatic pressure and glomerular oncotic pressure. Similarly, you have hydrostatic and oncotic pressure acting on the tubule. So that is called tubular hydrostatic pressure and tubular oncotic pressure. So let's apply this in this diagram. And this is very important because usually questions are asked like, what are the Starling's forces which will help you in filtration? What are the Starling's forces which will inhibit the filtration? So in order to learn that, look at this diagram. PGC. First, let's define the pressures in the diagram. So this is the glomerular capillary side. This is the Bowman's capsule and this is your tubule. PGC means hydrostatic pressure on the glomerular capillary side, that is GC. Pi T means oncotic pressure on the tubular side, that's pi T. And pi GC means oncotic pressure on the glomerular capillary side. PT means hydrostatic pressure on the tubule. So having defined these forces, now we should learn what are the two forces which are going to help you with this filtration. So look at the two forces, PGC and pi T. See, what are they doing actually? PGC is the hydrostatic pressure on the glomerular capillary side. So what did I tell you? What are hydrostatic pressures? Pulling or pushing forces. Very good. Hydrostatic pressures are pushing forces. So PGC will try to push the filtration to the tubular side. So this is the normal direction of filtration. Thereby it is helping you with filtration. So this is a force which favors filtration. Now look at pi T, the oncotic pressure on the tubular side. What did I tell you about oncotic pressures? They are pushing or pulling forces? Yes, they are pulling forces. They will pull the filtration to its side. So what will this pi T do? It will pull the filtration from glomerular capillary side into the tubular side. Thereby, this will also help you in favoring filtration. So two forces which favor filtration, PGC and pi T, repeatedly asked in your exams. Now let's learn the forces which will oppose filtration. Look at PT, hydrostatic pressure on the tubular side. So hydrostatic pressure is a, yes, pushing force. So what will it do? It will push the filtration from the tubule into the glomerular capillary side, thereby opposing filtration. See, normal direction of filtration is from the capillary into the tubule, but this PT is going to push the filtration from the tubule into the glomerular capillary in the opposite direction. So that is why it is opposing your filtration. What is this pi GC? Pi GC is oncotic pressure on the glomerular capillary side. So this is a oncotic pressure, so it will push or pull. Very good. It's a pulling force, so it will pull the filtration from tubule into the glomerular side, thereby in the opposite direction. So this will also oppose filtration. So the factors which oppose filtration, PT and pi GC. So hope you're clear with the Starling's forces and what they do to the filtration. So this can be asked in your exams about the favoring forces and the opposing forces. So having learnt about GFR and net filtration pressure, see what is net filtration pressure? If you take the forces which are favoring filtration and if you subtract the forces which are opposing your filtration. So just remove the forces which are opposing your filtration. That will give you net filtration pressure. So what is net filtration pressure? Favoring force minus opposing force. So these two are favoring forces and these two are opposing forces. So if you subtract both, you will get net filtration pressure. So let's do that. PGC minus PT minus pi GC. Did you notice that we have left pi T in the next step? Why did we leave off pi T? Can you think? What is pi T? Oncotic pressure in the tubule. So will there be any oncotic pressure in the tubule normally? Oncotic pressure is contributed by your plasma proteins. So look at this. So when the filtrate is coming into the tubule, this is the tubule, this is the glomerular capillary. Usually there are no proteins. If your glomerular basement membrane is good enough to filter, if you don't have any disease, it will not filter proteins. You will not have proteins. So if you don't have proteins in the tubule, will you have any oncotic pressure? No. So normally oncotic pressure pi T on the tubular side is 0. So this value is 0. So that's why we have omitted pi T in the next step. And if you substitute the normal values, normal value of PGC is 60 millimeters of mercury. Normal value of PT is 18 millimeters of mercury. Normal value of pi GC is 32 millimeters of mercury. If you substitute all this, you will get a net filtration pressure of 10 millimeters of mercury, which is your normal value. These steps are important because in your next pattern of exams, you can have questions like calculate the net filtration pressure and they can give you values for all this. So you know that glomerular filtration rate is directly proportional to the net filtration pressure. What does it mean? If the net filtration pressure is more, you will have more GFR. If net filtration pressure is less, GFR will be less. So let's substitute the formula for net filtration pressure here. PGC minus PT minus pi GC. What is this KF? How did it come? See, can you remember your physics and maths in your school days? Whenever you want to remove the proportionality sign, what do? We try to introduce a constant. So when you want to change a proportionality sign into equal to, we'll introduce a constant. So this becomes equals, and the constant here is Kf. So GFR is equal to Kf into net filtration pressure. So what is this Kf? Kf is called glomerular ultrafiltration coefficient. So what is it talking about? See, till now we discussed about the pressures or forces acting on the glomerular side and forces acting on the tubular side. But we did not talk about the filter as such. So when you talk about the filter as such, this Kf will give you the properties of the filter. Two properties of the filter. Kf is equal to permeability of the filter into surface area of the filter. Filter, I mean the glomerular capillaries. So Kf is equal to glomerular capillary permeability multiplied by glomerular capillary surface area. So Kf is talking about the properties of the filter. What are the factors affecting GFR? So we will learn this in an easy way by just remembering or recalling the four Starling's forces one by one. PGC. What is PGC? Hydrostatic pressure on the glomerular capillary side. So what factor will mainly affect this PGC? Blood pressure. Why? Because blood is only flowing into the glomerular capillaries. So blood only will contribute. It's the liquid component of the blood which is contributing to this hydrostatic pressure in the glomerular capillary. So if that blood pressure is more, GFR will be more. If that blood pressure is reducing, it will again affect your GFR. So PGC depends on blood pressure. So any variations in blood pressure can affect your PGC. What about pi T? What is pi? Oncotic pressure. Oncotic pressure is contributed by plasma proteins. So any change in plasma proteins can affect your pi T. Normally, I told you plasma proteins will not be present in the tubule. Why? Because if your membrane is very strong enough, it's not going to filter the proteins. So proteins are not going to come into your tubule. So pi T is 0. But if you have diabetes, hypertension, or any disease that can damage the membrane, especially diabetes and hypertension, they can cause damage to the membrane. So it's something like when your T filter becomes very old, no, and you're using it for a long time, or the pores have become bigger, it's going to allow all T dust particles into the T. So something like that happens in the glomerular basement membrane. In hypertension and diabetes, diabetic nephropathy, where the membrane is damaged. When the membrane is damaged, it is going to allow proteins into the filtrate. So now you might have proteins in the tubule. So proteins in the tubule, pi T, can be affected by hypertension or diabetic nephropathy. PT. PT is hydrostatic pressure on the tubular side. So what are the factors that can affect the hydrostatic pressure on the tubular side? Any tubular abnormality, any tubular block or any obstruction, can be a stone, or it can be a carcinoma or a foreign particle. So if you have any obstruction here, hydrostatic pressure will rise. Your PT will rise. So tubular obstruction or urinary tract obstruction. Pi GC. So what is pi GC? Plasma proteins contributing oncotic pressure on the glomerular capillary side. So any alterations in the level of plasma protein can affect your pi GC values. And finally KF, you already know, it is the multiplication of capillary permeability and surface area. So permeability, when it is affected, diseases like glomerular nephritis, where you can have any damage to the membrane, the permeability increases or the pore is becoming bigger. Or Mesangial cell contraction and relaxation. Can you remember what will the mesangial cells do? It can contract. When it's contracting, it will pull the capillary wall along with it, thereby decreasing the surface area for filtration. And mesangial cell relaxation increases the surface area for filtration. So KF is affected by all these factors. So altogether, all these factors are the ones which are going to affect the four Starling's forces and eventually your GFR. Let's learn about few more factors which affect your GFR. Afferent arteriole constriction. So what happens when afferent arteriole constricts? Just think logically. The arteriole which is bringing in the blood, if it is going to constrict, automatically blood flow will decrease. When there is no blood at all, what is going to filter? So there will be no filtration. So afferent arteriole constriction will decrease the renal blood flow. When there is no blood, nothing is going to be filtered. So filtration decreases. So there is a decrease in GFR. So this is one factor. The second factor is efferent arteriole dilation. See, the arteriole which brings out the blood, if it is going to dilate, what is it going to do? It is going to increase your flow from the glomerulus. So ultimately, there's not going to be any blood inside the glomerulus because it is flowing out into the efferent arteriole. So nothing is going to be filtered here again. So this also decreases the GFR. So both afferent arteriole constriction and efferent arteriole dilation will decrease GFR. Clear? So third factor, afferent arteriole dilation. See, if your arteriole which is bringing in the blood is going to dilate, obviously there is going to be more blood flow. So when there is more blood, more will be filtered. So this increases the GFR. The fourth factor, efferent arteriole constriction. So the arteriole which is moving out the blood is going to constrict. So this has two effects. So initial effect and later effect. See what happens initially. So initially, when there is going to be efferent arteriole constriction, blood is going to be stagnant in the glomerulus. So the water component, the hydrostatic pressure will rise. So because of this hydrostatic pressure, it will keep pushing the filtration to the other side. So eventually your filtration will increase. So initially increase in GFR. But at later stages, see what happens. So initially, because of accumulation of blood, hydrostatic pressure increases. But if this keeps on happening for a long time, not only blood, the plasma component is accumulating. Proteins are also accumulating. So proteins will slowly begin to get accumulated in the glomerulus. When proteins are getting accumulated, they will exert oncotic pressure. What is oncotic pressure? Pulling force. So this will pull the filtration from the tubule into the glomerulus in the opposite direction. So thereby decreasing your GFR. So initially there is increase in GFR because hydrostatic pressure pushes the filtration to the other side. But after a long time, these plasma proteins get accumulated and they will keep pulling the filtration in the opposite direction. Therefore, GFR decreases. So keep in mind, efferent arteriole constriction can have dual effects. It can initially increase GFR and later decrease the GFR. How will you measure this glomerular filtration rate? See, we cannot directly go into the glomerulus and measure the GFR. So we can use surrogate methods for measuring this GFR. Indirectly, we'll see how are we going to measure this GFR. So we can use clearance. What is clearance? Clearance means UV by P. What do we mean by that? We'll understand that. So look at this. Glomerulus, the tubule. So let's take any substance. This is the substance. This substance should freely flow in the plasma, and this substance should be freely filtered in your glomerulus, and this substance should not be reabsorbed by the tubule. It should not be secreted into the tubule, and it should come out in urine, and it should be a measurable one. If a substance follows all this criteria, you can use this substance to measure clearance. So what is clearance now? So this is the plasma and this is your urine. See, just think logically. If you are able to measure what is the concentration of substance in the urine, you're measuring what is coming out as urine, and you're measuring what is there in the plasma. So out of this much that was present in the plasma, so much has come out in the urine, and multiply that by your total urine flow rate. This will give you the clearance. So clearance is equal to, out of how much which was present in the plasma, this much has come out. P is the plasma concentration, U is the urine concentration of the substance, into, multiply that by the total urine flow rate, V. So UV by P is equal to clearance. So understand the concept of clearance. We are trying to measure how much was present in the plasma and what fraction of this is cleared in the urine. That is called clearance of the substance, and multiply that by the total urine flow rate. One such substance which will follow all these criteria and can be used to measure clearance or GFR is inulin. Inulin. So inulin follows all these criteria. So the problem with inulin is, it is actually a dye. You have to purchase this dye and you have to inject into the patient, and when you do this, you can anticipate any kind of hypersensitivity reactions in the patient, because it's an exogenous substance or a dye which is injected, a foreign body. So it can give you trouble. The patient can have some kind of anaphylaxis or anything. So that is one problem with inulin, and it's also a costly method. But accuracy is very, very, very good in inulin, because see, if you measure inulin clearance, it is giving you 126 ml per minute. What is your normal GFR value per minute? Yes, 125 ml per minute. Inulin clearance is 126 ml per minute. See how accurately or closely it measures GFR. If you measure inulin clearance, 126. If you measure GFR, 125. So inulin clearance is the most accurate method for measuring GFR. But it's a costly method. So that and it's also giving you a lot of reactions and all that. So to avoid all that, most of the clinicians, what they do in their clinics, it's difficult to do inulin. So they use another substance which has same criteria. It will follow the same criteria as that of inulin, a cheap method, and it's not going to give you any reactions also. That is creatinine clearance. Why? Because creatinine is a substance which is produced endogenously inside the body itself. It is produced by your muscle cells. You're not going to buy creatinine and inject and all. It's there already in the body, and if it follows all the criteria also. And if you're able to measure creatinine clearance, that can also be a surrogate for GFR. It can also indirectly give you the value for GFR. But the problem with creatinine is, it's an easy method, cheap method, but the problem is, if you measure creatinine clearance, it will give you 140 ml per minute. What is your GFR? 125 ml per minute. So creatinine clearance is overestimating GFR. It's giving you 140 instead of 125. But all clinicians know that creatinine clearance is going to anyway overestimate the GFR. So we have standardized the values accordingly. So you can very well use creatinine in your clinical methods. Another substance which is also produced by the body cells, and this also follows all this criteria, is cystatin C. So you can use, it's an advanced method. Cystatin C also can be used to measure GFR. And what is that substance which has clearance of 0? Or what do you mean by clearance of 0? Which means the substance is not cleared at all in urine. That's why the clearance is 0. Can you guess which substance will have clearance of 0? We already discussed this. Yes, very good. It is your proteins. Proteins will have clearance of 0. Why? Because if you have a normal glomerular basement membrane, proteins are not filtered. They don't come out in urine. If you take a normal urine routine test and see, proteins will be 0. Unless the patient has hypertension or diabetes, protein levels in urine will be 0. It means proteins are not cleared in urine. Clearance is 0. One other substance is glucose. Glucose is also 100% reabsorbed by the tubules. It does not come out in urine. So if you see a normal routine urine evaluation test, it will give you proteins 0, glucose 0. So which means that clearance is 0. Measurement of renal plasma flow. So for measuring GFR, we are using inulin and creatinine. How will you measure renal plasma flow? See here, you should use a substance which will get freely filtered and which is also secreted but not reabsorbed. So this substance should be freely filtered. It can also be secreted but not reabsorbed. So this substance is going to flow freely through the tubule. So if you measure this substance, it will give you the measurement of renal plasma flow. So one such substance is PAH, para-aminohippuric acid. So PAH is one substance which can be used to measure renal plasma flow. So GFR is measured by using inulin and creatinine, and renal plasma flow is measured by using para-aminohippuric acid.